It was just a coincidence. So many patients sending me pictures of their cats with their stress balls. So I thought that was kind of cute this week. The other thing that I had the opportunity to do was sit second row, thanks to my sister-in-law, right in front of Lady Gaga. You don't see me right there, but I'm just right there taking pictures at Lady Gaga. And what you didn't hear if you were at the concert also was me screaming at Lady Gaga, "I want to freeze your eggs! I want to freeze your eggs! Come see me!" But I don't know that she heard me. She has been public about talking about how she wants 3 children. Given her age, I think she should see me. That would be kind of cool. And then I can sing with her to one of my favorite songs, which is "Till It Happens to You." And that kind of goes in line with this article that was published this week. And the title of the article is "How to Talk to Your Friends Going Through IVF." And I was like, wow. Just use one of Lady Gaga's lyrics from that song, "Till it happens to you, you don't know how I feel." And I think that that's a really good point to make with your friends and family who are outsiders and they don't necessarily know how to support you. So this is a really good article to maybe share with them so they kind of know perhaps how to support you when you're going through something that can be so soul-crushing. And I'm a very positive person, but I do definitely understand how hard it is to be a fertility patient. So I do, as well as my staff, everything possible to make it as easy a process on my patients. Okay, so back to the topic of secondary infertility. So I just want to show a picture. So imagine I'm sitting here in my office. I'm not that far from San Francisco, and I want to go to this place here on this picture, right? So you're probably like, what is she talking about? Why is she talking about this picture? What does this have to do with a medical condition called secondary infertility? Well, if you're sitting somewhere and you want to go somewhere else, aren't you going to plan for it? I can tell you that I would probably look online, look and see what the weather's going to be there, get maps out, call my friends. If it's a place that I need vaccines before I go there, probably go to a travel clinic. That's kind of what we would do when we would want to go somewhere really, really important. And when it comes to fertility, I want to teach people that you can be just as proactive about planning your future family as you would be planning an extravagant, not just extravagant, but an extraordinary trip for yourself. So you don't just have to stumble upon pregnancy and be like, well, you know, I don't know, we're kind of thinking about it, maybe not really, but I want to change how we plan families in this country and make it such that we treat it as if it is a very serious medical thing, where you want to be as planned and careful as possible so that every single person has as healthy a pregnancy as possible without ever looking back and saying, I woulda, coulda, shoulda, if only I had known. Because if you imagine in my position, I see patients who come to me and they're saying, hey, why didn't anyone teach me these things? And so that's why I'm doing this show. I want to be that person that says, hey everybody, these are things that you can do. You can be proactive. You can learn more about yourself, your body, before you start having your family, especially if you want more than one child. And so this article was published, I think yesterday, on Forbes.com. And it said, very simply, what causes infertility? And so when you think about secondary infertility, meaning having trouble getting pregnant for your next baby when you didn't have really any trouble getting pregnant for your first, it's a lot of the same issues. So what could those issues possibly be? Well, it could be age. It could be female factors like fibroids in the uterus, blocked fallopian tubes, endometriosis, tubal issues, just like I just mentioned, and male factors like slow swimmers, not enough swimmers. It could be your lifestyle, and we'll talk a little bit more about that, and also stress. So stress can also be a factor, and I'll share with you my tips about what you can do about stress. So first, I just want to kind of look at this table and just point out how important or how significant age is when it comes to fertility and having a healthy pregnancy. So the CDC came out very recently saying that for the first time ever, women in their 30s were having more babies than women in their 20s. So I think what kind of happens with that kind of information is people might think that women in their 30s are actually more fertile for some reason than women in their 20s. But what it actually means is that older women are having the babies, and so more women will have problems having their second or next child. So we'll see more people with secondary infertility as we are, as a society, delaying childbearing. So if you start here, if you look at age 20, for example, the risk of having a baby with a chromosome issue or a miscarriage carriage. It goes up as we get older. And this isn't about me scaring people, this is just about education. And I want to educate people about the viability of an egg at their age, and I'll teach you about how you do exactly that, okay? And then I'll also provide the link for this study if you want to take a look at that chart in more detail. So this is also a really helpful article that I think came out in the last couple days by Dr. Adamson. He's one of the most respected, one of the most well-known, very respected fertility doctors and past president of the American Society for Reproductive Medicine. And he wrote a blog saying, please ignore the celebrity hype. Fertility really does decline with age. And with celebrity pregnancies, you hear them all the time. They're not necessarily as open and honest about where the egg came from. Let's say when the patient is, or the celebrity is 46, 47, 48, 49, or 50. And we all know that the chance of pregnancy with a 50-year-old egg is close to 0.1%, if not lower. And so these women are being more creative about their family building. And if women, let's say, want a pregnancy at 50, certainly the technology is there for them to freeze their eggs in their 30s so that they can achieve that later on. Okay, so this article also came out, and if you're a fertility doctor, you see things like this and you're like, whoa. So it's as if there's some sort of conspiracy out there where fertility doctors are trying to scare people into learning about themselves, and this couldn't be further from the truth. So this article titled, Why You Should Be Wary of Ovarian Reserve Testing Events at Fertility Clinics. Well, I would say, anything that promotes fertility awareness, to me, is pretty cool. Because if doing testing can save one patient from being a fertility patient in my clinic, if she's, let's say, able to learn something about herself earlier or sooner that will allow her to make changes or to do something differently so she has a baby earlier, I think that's actually being proactive and pretty neat. But what the article stated that I thought was misleading was that women should start testing after age 35 or after they've been trying for a year or more. And if you've heard me on this show, you hear me saying over and over and over and over and over again, get your levels checked, get tested, get ahead of infertility. But before you get your levels checked, you should realize there's a very emotional component to it. Getting your FSH or your AMH level checked isn't like getting your blood sugar checked. So when you go into the doctor and get your sugar checked or your cholesterol checked and someone says, your cholesterol is too high, you don't leave the office crying that someone's telling you that you're going to have a hard time having a baby. So when it comes to getting a test done, ask yourself, what are you going to do with that information? And are you emotionally prepared to hear the information one way or another? Because if you're not emotionally prepared, I would say maybe wait until a time that you think that you are ready to talk about this very personal test that can be done at a fertility clinic. So if you want to get the testing done through me, it's actually quite simple. You can go to the website eggwhisperer.com, step by step. We'll get you registered in my system. We'll send you out a lab slip, and I will review the results with you. And we can make a fertility plan together, and I can talk to you about when you should get your next set of levels done. Those levels are the FSH, estradiol, and AMH. FSH and estradiol are timed tests to your menstrual cycle. We call them cycle day 3 tests. They're done 2 days after your period start. Or the AMH test. The AMH test is a test that can be done any time in your cycle, but if you're on birth control pills, you should let your doctor know first, because there are certain times that you would want to do a test like this that might be better than others. So aside from, let's say, the blood work, you would also want to have a very complete pelvic ultrasound, looking for fibroids, looking for, let's say, cysts on the ovaries, like endometriosis, also known as endometriomas. That's what we call a cyst of endometriosis on the ovary. So if, let's say, you were having some sort of chest pain and you went to the doctor, they wouldn't just give you medications. They would likely do an imaging study, perhaps a chest x-ray, and echocardiogram. And I find when it comes to fertility medicine in patients, sometimes we tend to give patients medication without doing all the workup and tests first to figure out what the diagnosis is. So I'm hoping that by doing the show and teaching people about the things that they can learn about themselves, perhaps if you haven't had a pelvic ultrasound done yet, you should, to see if you have something like a polyp, a fibroid, fibroid or something else that might get in the way. So the other thing is, and this looks really fun, I wouldn't mind being here right now, is just hanging out on a beach somewhere, but your swimmers, are your swimmers just kind of standing there? Are they, going in a forward direction? So you want to get the swimmers checked. So that's a very simple test, a semen analysis, that's what we call it, and it can be done at a fertility clinic. There's actually a company that does a home semen analysis test. They ship you a temperature-controlled kit, you produce a sample, you ship it back, and the results look just as good as they would look coming from an andrology lab at a fertility clinic. So just talk to your doctor about a way to get your swimmers checked that's convenient for you so that you can learn about whether you should be changing your diet habits, see a urologist, do more advanced sperm testing. So get your levels checked with your blood for your fertility if you're a woman, get your swimmers checked, and certainly guys, it's a lot easier to get your sperm frozen than for a woman to get her eggs frozen. So the other thing is lifestyle and your diet. How many sodas are you drinking a day? We're hearing so much about how sodas, especially diet sodas, things with artificial sweeteners are not good for us. And then the liners in the aluminum cans have BPA in them, and they can potentially be endocrine disruptors and also affect the quality of our gametes, meaning egg and sperm. So really look at what you're doing as far as the foods you're eating, what you're drinking, not only that, but the makeup you're using. See how you can live as non-toxic a life and live your best life ever. And so a lot of stuff was trending recently about how sperm counts are going down over time for men. And I said, I tried to make a joke out of it. It's all because of the pizza and beer that we're eating and drinking in this country. I know that the serving size for a glass of wine for a woman is about 4 ounces. And when you look at that glass and you say to yourself, I wonder if the entire bottle is in this glass, you know that is too much. And sometimes it's better to just stop altogether than to decrease your consumption of these things. So if you're having a hard time figuring out what too much is, perhaps cut it out completely if you're trying for another baby. Certainly you won't be drinking in pregnancy anyways, so it's not a bad idea to get used to that right now. So when it comes to nutrition and diet, if you've had a certain diet for so long, you can meet with a nutritionist. We'll post information about someone who can work with you remotely, as well as someone who can help you with other things, including more vigorous exercise plans. We have someone local that will do that with you over the phone, Skype, text, and just be there for you as a training coach. So I work with both of these folks to help my patients get into their best personal shape ever, so that they can accomplish their goals with their lifestyle, so that perhaps they can have an easier time getting pregnant. And that's what I do. So I want to teach my patients what they need to know to help themselves get pregnant without my help. I know that sounds kind of like contradictory. Like, why would a fertility doctor not want patients to come in? I certainly want patients to not need my help. I know that sounds silly, but if a patient is going to see me, even if we end up doing a treatment, I certainly want them to be in a position to have the best chances, so that if we address these things first, then hopefully the treatment will be successful. And not everything works the first time, but if we're working on the lifestyle piece, at least we don't look back and say, oh, we wasted time not dealing with that up front. And the other thing is stress. So Dr. Shaheen, another good friend of mine, and she'll be on our show talking about her book, Not Broken, about miscarriages and recurrent pregnancy loss. So if you have a question about that, be sure to email us, because we'll be answering your questions during this show live. But a really nice blog article she wrote was about stress and fertility. So if I said to someone, are you stressed? And if the answer is yes, I don't need to do a test there. If you know you're stressed, then it's important to ask yourself, well, what do I need to do to reduce my stress? Okay, because there's so many ways of doing that. Look at your partner, your relationship. Think about ways you can support each other. Talk to a therapist, see an acupuncturist. Do something for yourself once a week, if not every other week. Things that you enjoy, hanging out with your friends, being more social, all of those things can potentially help with stress, so that when it's ready to try to conceive, your chances will be potentially a little bit higher with lower stress. So when it comes to treatment options, sometimes people are surprised when I say you should consider egg freezing. And this article in Cosmo was just published about how a 34-year-old talked about how she was married and wanted to freeze her eggs. And that sounds kind of counterintuitive. Well, I thought egg freezing was just for single people, and in fact it isn't. And there's so many reasons why someone might want to egg freeze if they're in a relationship, and one of them could be, well, if you want more kids and you don't necessarily want frozen embryos sitting around. So that's a very, I feel like if someone's thinking about egg freezing, even if it isn't for them, at least they're going to be a little bit more fertility aware. So that's one of the treatments, believe it or not, so that you can potentially prevent secondary infertility if you're starting your family in your 30s. So you can be one of those patients of mine who comes in at 40 and says, Amy, I'm going to use my frozen eggs. And I certainly have had those patients now. I have patients over 40 whose eggs I froze when they were in their 30s. And now they're pregnant with those 30-year-old eggs, and that's pretty exciting for me to share that with all of you. So some of the tests you should do for secondary infertility are very similar to the tests that you would do for primary infertility. So the tests would be blood work for FSH, estradiol, the AMH test, and other hormones like TSH, prolactin, and vitamin tests like vitamin D. Depending on your body size, you might want to consider a glucose test or a hemoglobin A1C and a lipid panel to make sure that, again, I keep saying this, that you're in the best shape of your life and you're getting the support that you need from other medical doctors if there are things that you need to work on to get those levels better before you start a pregnancy. A semen analysis or a swimmer test, a pelvic ultrasound looking at your uterus to see if there are polyps, fibroids, or cysts of endometriosis, a tube test, and that kind of sounds silly, like why would I need to make sure that my fallopian tubes are open if I've already had a baby? Well, what I tell my patients is that if you've been pregnant and had a pregnancy in your uterus, what that means is one of your tubes was open and you ovulated from that one side. And we actually don't alternate where we ovulate from, meaning it's not like every even month is from your right and odd month is from your left. So if you knew which side was open, you would know which side or when to be intimate and try to conceive. So a Tubal assessment can also be important for patients with secondary infertility. And I recommend pain meds, a Valium, a driver, because an HSG can certainly be very, very painful. When you read the stories online, you would think that it's one of the most horrible tests ever a woman can have. But if someone were to tell me I'm going to do something that's going to cause you pain, I certainly would hope someone would offer me a pain medication so that I would not have pain. And then there's also advanced sperm testing to look at DNA fragmentation in the sperm, as well as epigenetic changes in the sperm as well. And there are things that you can do to improve the sperm DNA. And one thing that I tell my patients, especially if someone gets pregnant with baby number one with me with an IUI, IUI stands for intrauterine insemination, kind of like the turkey baster approach, is freeze your sperm. Freeze your sperm so when you come back for baby number two in 1 to 2 years, 2 to 3 years, we can use the younger sperm with better DNA. And the other thing to do is a family prep panel, just making sure that both the egg and sperm contributors don't share the same mutations so that a disease isn't passed on. That's still something that I ask my patients to consider doing with secondary infertility. Okay, so as far as treatment, you hear me say this all the time, best personal shape ever. Because if you're feeling really good about yourself, if if you feel like you're healthy, you're eating right, you're doing self-care, that means that you're also able to take care of your family in the best way, and you can take the time you need to get the treatment you need. So that I think that's certainly number one, top of my list. So anything you can do to help your general health is also going to help your fertility health. And then the other treatment options, same as with primary infertility, is or would be fertility pills with or without IUI and IVF. You can also do fertility shots with or without IUI as well. But the most important thing before you choose a treatment is figure out what the diagnosis is. Do all the tests that I listed, or whatever tests your doctor thinks are best for you, given your personal story. Once you've done the tests and you see what's wrong, then you can say, okay, this is the treatment that would treat the diagnosis that I've learned about myself. Okay? And as always, get your levels checked, get ahead of infertility, and then be sure to tune into this show. Some of the next episodes that we have that I'm really excited about is, like I said earlier, talking about miscarriage and recurrent pregnancy loss. And it looks like I actually have a Facebook question. So I'm going to take a second here to log back into my computer because it timed out.
I can read it for you if you like.
Yeah, let me see. Yeah, go for it.
Is Is it possible for a woman who was unable to conceive naturally and who used IVF for baby number 1 to then get pregnant naturally?
Absolutely. So I see that all the time, and it's really fun for a patient to reach out to me and say, Amy, remember me? You know, we did all this treatment and now I'm pregnant naturally. So that just means that you had the perfect golden egg and sperm combination in that given cycle. And some of the reasons for that to happen, one of the reasons I think is, for example, endometriosis. So women with endometriosis, pregnancy actually treats it. So you can't get pregnant, you can't treat the endometriosis until you get pregnant in many cases. And so once you're pregnant from fertility treatment, the pregnancy will actually heal the endometriosis so that you'll have an easier time getting pregnant for baby number 2. So I definitely think that that is a possibility. And so I get emails all the time from my patients who say, Amy, this is the craziest thing ever. My OBGYN at my postpartum visit, they want to put me on birth control pills. I can't believe it. We tried so hard to get pregnant. And actually, it's actually not a silly idea to think about family planning after, struggling so long with fertility treatment. If baby number 2, you don't necessarily want that to come so quickly. So I have patients where I say to them, depending on their age, let's say you come to me and you're 40 years old and we didn't bank embryos, I say, as soon as you leave labor and delivery, you're going to come here, we'll do some testing, and then we'll talk about what our chances are for conceiving baby number 2. So you don't necessarily have to wait 2 to 3 years. You can always bank embryos first, and depending on how you delivered, whether it's a vaginal delivery or a C-section, the general recommendation is 18 months interpregnancy interval for someone who has had a C-section. Sometimes it's shorter, but I would talk to your personal doctor about what their recommendations are for you. But I like patients to wait at least 6 months or more after a vaginal delivery. That just gives the body time to heal and all the reserves to get restored. Let's see here if we have any other questions today. Good. Well, thank you guys for joining me tonight. I look forward to another fun show next Wednesday. I know you missed out on me singing Lady Gaga, but YouTube might completely shut me down if they heard me singing because they might think I'm her. So have a great night. We'll see you next week.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor. Just launched by an East Bay fertility doctor.